Hello, my name is Tajah and I will be taking some Peds measurements today. I have my tape measure here that's in inches and centimeters. I've got my hand sanitizer, and here I've got my paper to record the measurements. So we're first just going to start by introducing ourselves to the patient and to the caregivers and washing my hands at the same time. So hi, my name is Tajah. I'll be taking some growth measurements today. Can I have the patient's full name and date of birth? Awesome, thank you. So we're just gonna get started here by taking a head circumference. And for the purpose of this, I'll be doing it in inches. So we're just gonna position the patient supine. If they're old enough, they can sit up, or with the caregiver's help, they can sit up. We're just gonna start by placing it after we wash our hands, because I just touched my eyeball. Okay, so we're gonna start by placing the 0 on the forehead, and I'm gonna tuck it under as far as I can and roll the patient to the side, being careful of the baby's neck. And the 0 is just above the eyebrows and just above the ears, and we're gonna bring it together here, asking the parents for help if the child was being uncooperative. And it's about 11 inches here when it's all brought together. So we're gonna lift the head, move this out of the way, place the baby down, come over here, and record our measurements so we don't forget. Okay, now we're gonna do a length measurement, and I don't have a headboard or a footboard, so we're gonna do the old-fashioned way, I suppose. We're just gonna hold the child still, and then right at the top of their head, mark. And then I would hold the baby's legs, flatten them out, and then right at the bottom of the heel. This baby's legs do not go flat, so we're just gonna pretend like it did go flat. And then mark here. And then we're gonna scoop and move the baby, or give him back to the caregivers. And then measure both marks. Here's the 0. And here, you can't really see that, but I'm just gonna scoop the baby. So we're at right about 13 inches here for the length. Here, 13. And if at any point the child was being uncooperative or the patient's caregivers had questions, you would answer them to the best of your ability. So we're going to scoop the baby and bring them back here. Lastly, we're going to be getting a chest circumference. So at this point, I would give the child to the caregivers and ask them to disrobe the child. So I'll do that now. Here. And then kind of the same gist with the head circumference, but we're gonna go place the 0 above the nipple line, and then we're gonna go underneath the armpits. So we're gonna tuck it as far as we can underneath them here, roll them to this side, pull it through. We're gonna be careful to hold the child's head. I'm not good at this, but we're doing our best. Set the baby back down, and then pulling it through over here underneath the armpit and above the nipple line again. We are at 9.5 inches around the chest. Yeah, 9.5. So we'll roll the baby to the side again, pull it through, And now I would give the child back to the parents to put their little clothes back on. Of course, the child wouldn't be this cooperative. They'd be kicking and squirming, but there we go. We're gonna come back over here. And then we would wash our hands and go chart the measurements we've just taken in their growth chart and assure the parents and send them on their way.